Your second study looked at generalized epilepsy in elderly patients who were undergoing the EMU evaluation. So can you just talk a little bit about that trial, and were you shocked by any of your findings?
To back up and just talk about generalized epilepsies in general. So there are two common forms of epilepsy, as your viewers would know, the focal epilepsy and the generalized epilepsy. Focal epilepsy constitute around 70-75% of the total epilepsy burden, and generalized epilepsy account for around 20 to 25% of overall epilepsy. And when we talk about generalized epilepsy, the typical picture that comes to our mind is of young children, adolescents, and young adults. That's when, in general, the generalized epilepsy onset starts. Okay, and in general, around 90% of patients who have generalized epilepsy are younger patients. So it's quite rare to have older patients who have generalized epilepsy, especially new onset of generalized epilepsy. Okay, so it's rarely reported. What we wanted to do is, again, with the same theme that with the baby boomer population getting older, more and more older patients that we're seeing in clinics, what is the experience of management of these patients who are older adults and elderly who have generalized epilepsy? So just to give you an idea overall, valproate or Depakote, which is the gold standard medication for generalized epilepsy, was kind of came into market in US in 1970s. So many of the baby boomers were at that time maybe were initially getting diagnosed or being started on the Depakote for the first time, and other medications that have come since. Now, potentially some of these patients have been on medications for 30, 40, 50, 60 years of their life. So first we wanted to see how are they doing right now, people who are 60 years and older and have generalized epilepsy, and how are they managed, how are they well controlled or not at this age. And also the second aim of the study was to see if there are some patients or some older adults and elderly who start to show generalized epilepsy much later in life, because that is not kind of a general thing that we learn or read in books and papers, because generalized epilepsy is typically considered a disease of younger adults and children and adolescents. So the most interesting and surprising finding was that of the 30 patients that we have, is a small cohort, of course, and the 30 patients who were diagnosed with generalized epilepsy in the epilepsy monitoring unit, 10 of them, which is 1/3 of them, had onset of epilepsy or generalized epilepsy after the age of 50 years. So very, very late in their life, for the first time, they started to have generalized epilepsy, which was quite revealing and shocking, because when you talk about new onset epilepsy, which is late in life or late onset epilepsies, we typically think or jump onto conclusion that this must be a focal epilepsy, and which is correct in, I would say, 90-95% of the cases for sure. But our study shows that sometimes it may be wrong to assume that all epilepsies that start later in life are focal epilepsies, as we see here that there are some small number of patients who can have generalized onset very late in life as well.